Welcome to another episode of Cutting Edge Health. I'm Dr. Orlando Landrum, and today we are talking about, is emotional health the same as mental health, and why this matters. For those of you who haven't had this conversation or are well aware of what it is, we're going to talk about it, but we're not going to talk about it just with how we feel. We're going to talk about it with science based behind it. We're using two predominantly resources, and the first resource is the following, is from the British Medical Journal, which is What is Mental Health? Evidence Towards a New Definition from a Mixed Methods Multidisciplinary International Survey. And in addition, we're also using from the NIH, National Institutes of Health, the Emotional Wellness Toolkit. So let's talk about what are the differences and really, quite frankly, why this even matters. So the main differences is mental health is an overarching term. So what does that mean? It means it's part of the broader of the two. It basically involves emotional, psychological, and social well-being. It's how we think, feel, and act. It determines how we handle stress, how we relate to others, and how we make choices. Emotional health falls under mental health, and basically it's our ability to be able to cope with both positive and negative emotions. So let's go into a little bit more detail, more definitions, so we kind of get what does that really mean and why it really matters. So mental health, emotional health are basically important for how we're able to cope in the world. It's how we affect how we feel and how we think, and vice versa. The Latin root of mentalis means mind, while emotion comes from the Latin word emovere, which means to agitate. So mental health is more on thinking, while emotional health is concerned with expressing feelings. As mental health is typically concerned with illness, it is likewise more related with medical services and traditional organic treatment as opposed to emotional health. As compared to mental health, emotional health is more often related to how we deal with things socially. So again, mental health is broader when compared to emotional health. So why is mental health important for overall health? And this is something I think is very frequently not pushed, is not understood, is that mental health itself can cause physical health to be worse. And I think we've said that, or people have felt it, but they haven't had true understanding as to why that is. Is that really legitimate, or is it just something that we think, but there's not true basis behind it? Where there is, we've been able to see that there's worsening of diabetes and heart disease and stroke, and there's a number of reasons for it. And we're going to go into why those things are. In addition is how common are mental illnesses. So mental illnesses affect 1 in 5 people. And in age of 13, over 1 out of 5 youth actually have a problem during a portion that they have a seriously debilitating mental illness. And of that, about 1 in 25 adults have a serious mental illness that impacts their functioning, whether it's schizophrenia, bipolar disorder, or major depressive disorder. In addition, for those of you who suffer from debilitating pain, we know that it's not uncommon to have depression that's associated with it, and rightfully so. But there are other medical conditions that also are really closely aligned with depression and mental changes. And so those are going to be things like Alzheimer's, autoimmune disorder like lupus and rheumatoid arthritis, cancer, coronary disease, diabetes, epilepsy, HIV, hypothyroidism, MS, Parkinson's, and stroke. So let's talk about the physical ramifications of mental health and what's associated with it. Frequently, what we see is that this aspect of anxiety, depression, chronic stress, PTSD results in a physiologic pathway that changes how cardiac reactivity is. It reduces blood flow to the heart, and it increases cortisol. We're going to go into why that matters, but that can precipitate or worsen stroke, heart failure, cardiovascular disease, metabolic disease, and coronary artery calcification. And then subsequently, these changes can then have impacts on how we feel. So at the end of the day, Why is this important? Because sometimes mental health is stigmatized, it's pushed off to the side, and it's like, well, is it really a big thing? We can get over it. Well, the reason why mental health, besides the actual aspect of it being an issue into itself, is it has physiologic ramifications. And some of these are the following reasons in terms of physiologic manifestation. And that is, what they've seen is when they've evaluated this, is mental health can have impacts on increasing inflammation. It can change the control of how the heart rate is actually being able to monitor and what is stability of what the rate should be. It can change blood circulation. It can change abnormalities in stress hormones. And it has metabolic changes, which can be important for patients that have diabetes. So all of these things from a mental health standpoint have an anatomical or physiologic impact. And so when we think about these long-term dynamics of depression, anxiety, PTSD, stress, again, it can change heart, it can change blood flow, it can change heightened levels of cortisol, and all these things can result in calcium buildup in the arteries, metabolic disease, and heart disease. So coming back to those terms of mental health and emotional health, we see these interlacing circles like a Venn diagram, where we see mental health, physical health, and social health. And this paradigm is that one of those papers that we referred to earlier, but in essence, how we think about it, how we express it, how we feel, and how we react has a number of different things that are in place. And you can see these other interlacing pieces like autonomy, a sense of us, agency and control. At the end of the day, basically it's that element of why might you feel down or why might you feel a bit lost? Because you're not the same person that can do the same things that you like to be able to do. You can have issues with being able to do the things for yourself that you want to be able to do, and you have to have dependency. You being able to make choices about how you can do things for yourself and really how to be able to influence and control what goes on in your life. So we're going to talk about some potential ways that you can be able to improve both mental health as well as emotional health. So let's talk about that. So different strategies for being able to improve emotional health. And so these are broad topics, but we're going to get into more depth. How to be able to build resilience. We're going to talk about that. How to reduce stress, how to get quality sleep, how to be able to strengthen social connections, how to cope with loss, and how to be mindful. So when we look at emotional health in two categories that are really kind of important for what we do in terms of being able to improve it and maintain it is resiliency training and stress management. So resiliency training is the ability to be able to deal with adversity and how to be able to recover quickly after experiencing a challenge. And there are different things you can do for that. Stress management, we've heard about before, but these are going to be under that emotional health paradigm that look at how can we be able to improve mindfulness and meditation. And so sometimes we can look at potential apps that might be able to improve things. And we got a listing of 4 different apps for those of you who are able to lean into this. So one app is the following, which is the aspect of Headspace. It's a catch-all that has a whole host of different options. It's probably one of the most broadest and robust apps. The second app is an app called Calm, which is an app that really focuses on how to be able to relax and how to be able to improve sleep, which is integral to being able to have that ability to be able to deal with emotion appropriately. A third is an app that's free, which is always kind of key, and that's Insight Timer. And then finally is a fourth app for those of you who, even like myself, were a bit skeptical. That's called 10% Happier, which actually was developed by a television personality that was actually given a live interview and had an anxiety attack and was like, I'm just not so sure that these things are really going to be useful for me. One of the other treatment options that's out there that we deliver in our own clinic is Alpha STEM, that is able to be able to improve anxiety, insomnia, and depression. That's a non-invasive treatment that can be able to utilize different therapies to be able to improve those things predominantly. That results in decreasing anxiety by 94%. It allows for you to be able to have just a 20-minute session and improves treatment that results in less utilization of medication. So coming back to this component of emotional health versus mental health, as we kind of land this plane and we say, okay, so what are the differences? We look at the aspect of mental and emotional health. Mental health is largely focused on cognitive processes. So really how we perceive and how we make decisions. While emotional health is focused on how we express feelings like anger, happiness, fear, sadness. And mental health is usually associated with illnesses, while emotional health deals with how do we deal with stress. We talk about positive psychology. Positive psychology is associated with emotional health. How can we be able to have happiness, hope, and resilience, like those 6 strategies we made reference before? Medical assistance is normally associated with mental health and the connected disorders. So we compare this again. Mental health, as mentioned before, comes from that Latin word mentalis, while emotional health comes in movere. And in essence, one is mind, the other is to agitate or to stir up. Mental health is focused on thinking. Emotional health is focused on expressing feelings. Cognitive processes versus affective. And then how can we be able to ameliorate or treat these things as we need to? We've covered and talked about treatments for mental health. Emotional health is how can we empower you so that you can find ways to be able to build that resiliency and find ways so that you can be able to cope with stress and do it in a context that's a good fit for you, which frequently isn't really discussed. And so it's one of the reasons why we want to kind of bring this to the fore, that not only is mental health important, emotional health is important just as well. Hopefully you found this topic of value. If you did, please give us a like. If you find that this is something that's important to you or people that you care about, consider subscribing to the channel, because we talk about not just what it is, but what to do about it and how to be able to punch pain in the face, whether it's physical or whether it's mental, and how to get back to leading the life that you deserve. Thank you so much and have a great day.